With the current surge of the Omicron variant, some schools are pivoting back to remote learning, but that is causing concern about the impact that could have on students, in particular, their mental health. This as the pandemic has seen increasing rates of depression and anxiety among children, adolescents, and young adults. The American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association released a joint statement in October declaring the situation a national emergency. And joining me now to discuss is Allison Ricciardi, founder and president of CatholicTherapist.com. Allison, welcome back. Always so great to see you. Let's talk a little bit more about this. Why would going back to remote learning, why would that have an impact on children's mental health? What does that signal to them?
It signals danger that really doesn't exist for children, particularly with Omicron. I mean, this is just beyond. So I think it's important that parents have discussions with children to allay their fears, to reassure them that there really is nothing to be afraid of, that this is a big overreaction on the part of many people. I think we need to have those conversations with kids. Also to make efforts to get your kids together with other kids. You know, and if this first hit, a lot of parents are very scared. They didn't know what to do, but we know now that this does not pose a tremendous risk to children. In fact, children have a greater risk of dying in a car accident than they do of dying of COVID. So to try to find those opportunities to get them together with friends, to discuss with them that the masks are not really necessary, that they may be in a situation in schools where they're being forced to wear them, but there's really no scientific studies demonstrating that masks work at all. In fact, there are studies showing that they're actually harmful. They're causing staph infections, throat infections, all sorts of things that kids are dealing with right now, not to mention taking away their faces and all the social cues that they need. So whatever efforts a parent can make, certainly to push back against this is important, to let your children know you're standing up for them. But like I said, they need that socialization. They need to get outdoors. They need to see their friends. This has been an absolute psychological disaster that these kids have been going through. It's been just horrible.
Yeah, and Allison, why do you think, children in particular have, suffered negatively and been affected by the pandemic? Why children?
Well, children are going to take the cues from adults. So when they see adults walking around being so terrified of everything, and also the masks have really reinforced a lot of fear. I mean, this is a very strange world for children to be growing up in. Children, especially young children, they look at social cues by facial expression. So when you take that away, you're taking away their identity, you're taking away their ability to really understand like the nuances of communication. So, for formative years, this is really very detrimental to children. And children, we're supposed to be protecting children from unnecessary fear. That's the whole idea of childhood, right? That innocence, and that's being really taken away from them. So I think, again, to discuss it with your children, to let them know that maybe you don't agree with the whole thing, that sometimes we have to go along with things that we know don't make sense, because this is the world that they're in right now. So they need to have that communication from the parents.
Yeah, and before I let you go, on a brighter note, I want to pivot to that. We just began a new year. Do you have any tips for those who are trying to stick to and maybe stay consistent with their New Year's goals and resolutions, and any other advice?
Yeah, this is what I call this, the second week of January, it's reality check time. Sometimes people set up too many resolutions, or they're just not realistic resolutions. So what I recommend is, have one or two, because it takes about 30 days to create a new habit. So once that's established, then you move on to the others. One thing that could be really helpful, I just launched CatholicLifeCoaches.com recently, and working with a coach that can help you to discern what your goals should be, what's really going to work for you, your lifestyle, your family, your state in life, and also to help those goals to be broken down into actionable steps that become achievable. It's super empowering to know that we can do this, but I think sometimes we just kind of throw it all out there and we really don't know how to accomplish them. And also having somebody working with you to kind of keep you accountable so that you can accomplish those things makes a big difference. But I think the main thing also, if you can anchor a new habit to an old habit, So maybe, if you want to start taking vitamins on a regular basis, have it with your breakfast, as a simple example. Or certain things, or you want to listen to Bible in a year, maybe do that on your way to work. So you're anchoring it to an old habit. And after you've established one or two, then move on to the others. Because if you have too many priorities, you really have no priorities. So we need to kind of limit them. And I think that's really, really helpful.
Yeah, that's all great advice. Well, Allison, thank you so much for coming on. Always appreciate it, and always great speaking with you.
God bless you.